I'm on the phone with Dr. George Caughey, Chief Pulmonary Critical Care Sleep Medicine Section in San Francisco VA Medical Center and Professor of Medicine at UCSF. Dr. Caughey, good morning and thanks for agreeing to the interview.
Thank you.
You recently conducted a study regarding the exposure to common environmental bacteria may be the cause of asthma. Can you summarize that study?
Well, yes, it was a study in mice of a common bacteria called Pseudomonas and its effect on inflammatory cells and bronchitis and pneumonia in the mice. And what we found, somewhat to our surprise, was that the bacteria persuaded a type of white blood cell that's very common in pus and infections in the airway to produce histamine, which is usually associated with allergy and is made by cells like mast cells associated with allergy. But in this case, they were made by white blood cells, neutrophils, that are more commonly associated with an infection. The difference is that the bacteria persuaded those cells to go into the business of producing a substance, histamine, that's more commonly associated with asthma and allergy.
Interesting. So the key findings were that it is a bacteria.
Pseudomonas. The bacteria is called Pseudomonas, and it's a particular strain of that bacteria, Pseudomonas aeruginosa. It's very common in the environment, but it's a frequent cause of lingering airway infections, chronic as well as acute bronchitis and pneumonia in humans.
Are we at a point yet where we can identify potential cures or potential treatment options for this particular bacteria?
Well, this bacteria often is challenging to treat, but in many cases the bacteria can be treated with available antibiotics or a combination of antibiotics. It can be challenging in some people because this particular bacterium is famous for becoming resistant to the usual antibiotics and being very resistant to treatment. It also has a way of lingering in the airways of certain people, especially people with cystic fibrosis, and from whom it can be very difficult to eradicate. It can be suppressed but not eradicated. So there are treatments for this bacteria, and not always effective.
Very interesting. Well, thank you for that. So we've been following the study of chlamydia pneumonia.
Chlamydia, yes.
Is there any relationship between the two?
They're both bacteria, but they're not very closely related as bacteria go. But they are also related in the sense that they are both common causes of lung and airway infections.
And antibiotics are treatment options for both. Are both antibiotics recommended, or is there a generic antibiotic that's suggested for either one?
In some cases, they could be the same antibiotics, but usually, if you knew which bacterium you were dealing with, you would use different. You would make different choices for treating the two. You know the association between chlamydia and asthma. This is what you've probably been hearing about.
That's right. Yes, we've reported on that fairly extensively. Is there a specific treatment option for this particular set of bacteria?
No, I really can't recommend one, and often it takes a combination of antibiotics. What's done in practice is that in some cases, and this would apply more to people with cystic fibrosis than to those with asthma, is to give a combination of drugs while trying to figure out what the bacterium infecting a given patient is sensitive to. And then once that is determined in the laboratory, then narrow down the antibiotic choices to the ones that we know will work. And in many cases, inhaled antibiotics have been used, which is a more unique approach to this organism.
Interesting. Is there a particular test for Pseudomonas?
It can be cultured in the laboratory on bacterial plates by standard techniques. It doesn't require very special techniques to grow for the most part.
Very interesting findings, Dr. Caughey. We certainly appreciate all that you do for research, for the asthma community, and most definitely for your time today.
Okay. I appreciate the opportunity to talk with you. Thanks for your work with the World Asthma Foundation. I think the website is interesting.
I appreciate that very much. Thank you so much.
Yeah. All right. Welcome. Bye.